All right. Good evening, everyone. Hello. Thank you for joining our program overview for Brown's Master's in Public Health for the School of Public Health. My name is Emily McGurl, and I am our admissions coordinator for online programs at the School of Public Health here at Brown University, and I will serve as your moderator for this event. I am also the admissions coordinator for online programs, so I will be your contact from when you are completed your application all the way up until matriculation before you start classes. So we'll dive right in here. So we're going to meet our presenters. So we have a lovely panel of presenters this evening, and I will let them introduce themselves, starting with Dylan.
Hi, everyone. I'm excited that you're all here this evening. My name is Dylan Hennigan. I'm the program manager for Online Masters in Public Health and the Biostats. So if you need anything, feel free to reach out, and I'll pass it to Nithya.
Hi everyone, I'm Nithya Ramesh. I'm the director of the online MPH program, and I provide administrative oversight for all the online programs at the School of Public Health. I'm a dentist by training. I'm an alum of the in-person Masters in Public Health program at Brown University. I've been a part of this online MPH program from its inception, so I'm happy to answer any questions you might have about the degree, what you can do afterwards. Happy to answer any of those questions. And I'll turn it over to Kim.
Hi, everybody. My name's Kim Pulaski. I am the graduate recruitment coordinator for this program. I too have been with this program since its inception and helping people to get some of the details, help them through their application process, whatever you really need so that you feel confident and excited to apply for the program. I've also been in higher education for about 15 years at this point. And so I am excited that you guys are here with us. I think you will greatly enjoy the online Masters in Public Health.
Great, thank you. So thank you so much to our presenters. So the way the webinar is going to work is we are going to talk a little bit about the introduction to the School of Public Health. We'll dive into the program format, talk a little bit about curriculum highlights, and go through some of the courses that you might be taking in this program. We'll then talk about the ILE and the practicum, which is a component of the program. We will go over an application checklist, and then at the end, we will do a live Q&A. So you'll notice in your screen, you have a Q&A function. So if you have any questions throughout the presentation, please put them in the Q&A. If we can, we'll try to get to them during the presentation, but we will have designated time at the end for Q&A where we will be able to answer your questions live. So again, please put your questions in the Q&A as you have them, but we will kick it off with an introduction to the School of Public Health. And I will turn it over to Nithya.
All right, so the School of Public Health has 4 academic departments. We have biostatistics, health services policy and practice, epidemiology, and behavioral and social sciences. Our faculty who teach in the online MPH are very much part of these departments, and you'll see more about them as we go further into the slides. We have 14 research centers. We have the Center for Alcohol and Addiction Studies, to the Pandemic Center, all doing different kinds of research at the school. We get $51 million in annual grant funding, and we have a pretty low student to faculty ratio. And there are faculty who are trained specifically to teach online programs who teach in our program. And as you may know, Dean Jha is the leader of our school. He is an accomplished and practicing physician. He's a longtime leader in public health, and he's very well known for his handling of the COVID-19 pandemic and his role that he played in the White House when President Joe Biden appointed him as the COVID-19 response coordinator, describing him as one of the leading public health experts in America. Now, Dean Jha's vision was to create a public health program that you didn't have to travel to Providence to get. He wanted to make quality public health education accessible to you from wherever you're joining us from. So this program started because of a vision that he had to make public health programs that taught skills about leadership and communication to its students, because that is the need of the hour today. We also have leadership that includes Dean Francesca Beaudoin, who is the academic dean for the school, and we have Dean Ron Aubert, who is the Senior Associate Dean of Education and Student Services. Ron is the Dean of the People. He's always there. He's always available to our students. He attends every orientation. He's at every event, and students have a lot of face time with him. And then there's me, the academic director. We also have some amazing faculty who teach in our program who bring real world experience to their role. So for example, we have Professor Alex Glazier, who's the Assistant Professor of Health Services Policy and Practice. She is a law professor as well, and she has a background in public health as well as law, and that makes her a really good person to learn leadership skills from. And that's the course she teaches in our program. Students seem to really love her courses, because her class, because she brings experts. She herself is an expert. She is a founder and president of a nonprofit that deals with organ donations. And in her class, you get exposed to leaders who are CEOs and other roles they play in different varieties of public health organizations. And you get exposed to all of them through video recorded lectures and interactive sessions in her class. So her class is really popular in our program. And it's the first one that you take when you enter the program. And then we have Professor Mike Harvey, who is from the Health Services Policy and Practice Department. He teaches the US Healthcare Policy course as well as the Comparative Health Systems course to give you an understanding of what health policy can entail. And then we have Professor Karen Andes, who is part of the Behavioral and Social Sciences Department. Karen is also the director of the in-person Masters in Public Health program, and she's a wonderful collaborator. She comes with over 30 years of experience in qualitative research methods, and she focuses primarily on the growing homelessness situation in America. And then we have Professor Crystal Linkletter. Crystal was my professor 10 years ago. She has been part of the School of Public Health for many years. She teaches in the in-person program as well as the online, and all the other faculty do as well. The ones I mentioned, they all teach in the in-person as well as in the online program. And Crystal, she has this way of making biostatistics easy to understand, which is a gift. So Crystal is amazing, and I'm really glad that our students have the opportunity to learn from her. And last but not the least, we have Hannah Zubrowski, who teaches our epidemiology and ILE courses. Hannah has developed the ILE course to be really easy to go through in our program. I think it's one of the strengths of our program that it makes this really huge addressing a public health challenge course project that you have to do, which is a requirement from our accrediting body. She has made it into a course that's easy to follow and you can accomplish within the duration of a semester. So we have some wonderful faculty who teach in our program.
Thank you, Nithya. So next we're going to talk a little bit about the program format. And for this, I will turn to Dylan to walk us through the program format.
Yeah, thank you, Emily. So our program format is 100% asynchronous and it's delivered through Canvas, and that's where you'll end up engaging in discussion boards, submitting assignments, things like that. We do offer weekly optional synchronous sessions, and this is your opportunity to meet with your instructor, collaborate with your peers. They are optional, but we highly encourage you to attend if your schedule permits it, because it's, like I said, it's a great opportunity to kind of network with everyone. A lot of our peers say that they learn a lot from each other. So, this is an opportunity to kind of come together and learn from each other and your instructor. We have 6 consecutive semesters, so it's back to back, fall, spring, summer. This is for the summer 25, so it'd be going, nonstop through 24 months. It's a lot of work, but it's worth it in the end. And then we do offer a 16-month accelerated sequence option. And we kind of recommend that lightly because that's a lot of work as well. A lot of the students say, I think it's 12 to 15 hours of coursework. So if you add that up, it ends up being a lot, especially if you're a full-time worker. So I would only recommend if you're not working full-time or you don't have other family commitments, that might be something to look into. But again, it ends up being a lot of work towards the end. And we do offer part-time. So if you feel like you want to take one course a semester, that's an option as well. You can always meet with myself, or we have our coordinator of advising, Alexis. She's a great resource to reach out to as well. And we have $5,200 a course for our tuition. We offer merit-based scholarships from 12,000 to 30,000. And then we also offer a Dean Scholarship. And that's a really great opportunity for our summer cohort because usually the summer cohort is a little bit smaller. So there's definitely a better chance to get the Dean Scholarship as well. And then over all of that, we have 12 total courses that you'll end up taking. And I think on the next couple slides, we'll dive more deeper into kind of like what those courses are and how they're spread out over the semesters.
Thank you, Dylan. So now we'll dive a little bit deeper into the curriculum highlights. And for this, I'll turn back to Nithya to talk to folks a little bit about what they'll learn in this program and a little bit more about the courses and the course content.
Thanks, Emily. So in this program, we are a generalist program. Now, the kind of people that this program is designed for is you are looking to get an overall introduction to public health. You want to know, what can I do in public health and have a career in public health? B is if you're already working in public health and you want to take your career a step further, have a master's degree and do master's level work in public health, that's another opportunity. Now, people think that, oh, if I'm not doing an epidemiology program or if I'm not doing a biostatistics program, is that going to, look bad on my CV? But, an MPH is a broad degree. And I think the strength of our program is that you can customize it to fit your needs. Now, for example, I'm a dentist, and if I go through these courses, I'm going to try and fit every course to be related to oral health for me. So when I'm doing the policy course, I'm going to write a policy memo on an oral health policy. Now, the same thing, if I'm going to go through and I'm going to do the communications course, I'm going to come up with a communications memo or a communications brief on how I can address an oral health challenge. So you can go through this program and you have the option to go through and make this specific to your public health interest. Now, if you don't have an interest, that's fine too. You can pick any topic, but this is specifically for those who come in thinking, I'm really focused on maternal and child health, or I'm really focused on climate change. You can make the courses and your products that you're developing in each of these courses be specific to your interests. We also have a case-based learning curriculum, which means that we're not teaching our students through midterms and finals. It's not that kind of program. In our program, in every course, you get real-world applicable products that you can apply immediately into your work. And that's consistent feedback that we've heard from our students who are in the program. And it's one of the things that we rate the highest on in our student satisfaction survey is the ability to take what students are developing in their courses and immediately apply it into your work as a public health practitioner. We have courses, as I mentioned, we have courses in biostatistics, epidemiology, communications. And if you look at our course titles, they're also about how you can apply these concepts into public health practice. So because that is the focus of our program. And I also mentioned earlier that Dean Jia's vision was that we need to be training a better workforce in public health that knows how to communicate healthcare information and also serve as leaders in public health, because that is the need of the hour right now. We need to be able to combat all of the misinformation that's out there, and through rigorous training in leadership and communication, that's what we hope to achieve as well. Now, with this degree, we have students coming into this program who may not necessarily be in public health careers already, and they have gone on to do a career switch into public health. We have our students go into consulting, academic and nonprofit roles, they go into government roles, and a variety of other roles that they get after they graduate from the program. Many of them, because they come in at a more senior level to our program requires a minimum of 2 years of work experience. So they've already come into this program with some amount of work experience. So the roles that our students get into after they graduate from that program, it's like we've had people become chiefs of staff, we've had directors of different departments of public health. So our students are in pretty high levels after they graduate from this program. And you also get a connection to Brown's vast alumni network. I can tell you from my personal experience that I've got 2 of my previous positions through referrals from the alumni network of Brown, because they really, look out for each other, and you can access them through the Brown Connect portal that gives you direct access to alumni, not just at the School of Public Health, but university-wide as well. So that's definitely a strong resource to take advantage of. All right, and these are the semesters that we have and the course sequence that you typically take. So we start off with, like Dylan mentioned, we have 2 courses every semester spread over 6 semesters in the standard sequence. So you would start off with epidemiology and public health leadership, and then you take biostatistics and public health communications. So if you notice, there's a pattern where we pair up what is a more quantitative or a more heavy course with something that's more applied and more like considered to be an easier course, but I wouldn't say anything is like difficult or easy. It's really the strengths that you come to this program with. So if you're a statistician, you may find biostatistics very easy, but you may struggle with communication, as just an example. So we try and pair contrasting courses together so that you're applying different skill sets at the same time. And if you are somebody who's not good at math, you should not be struggling through epi and biostatistics at the same time. So we try and put complementary courses together. So you can see how our courses have been laid out, and everybody takes the ILE course, which is our integrative learning experience course at the very end of their last semester. That is the course which I mentioned Dr. Ziobrowski runs, where you apply the skills that you've learned across all the other courses that you've taken in the program, and then you apply it to develop a strong research paper that addresses a public health challenge. And if you want to accelerate it, this is the accelerated option where you can take 4 courses in the first 2 semesters and then take 2 and 2. You can also do 4, 4, and 4. It's up to you how much you want to accelerate. Again, once you come in, it doesn't mean you're married to that track. We are flexible. So Dylan and Alexis are available for you. Like Dylan said, if you want to customize your plan of study, you are welcome to meet with us and we can give you an altered plan of study and you can switch back and forth. You just have to let us know during your registration period and we'll get that set up for you. So now, if these many courses are too much for you, you can even take just the one course in a single semester. So that way you can easily juggle your work and other responsibilities. Now, in addition to your ILE, you also have an MPH practicum. The MPH practicum is 145 hours of an internship experience or a community engagement experience where you have the opportunity to apply knowledge that you've got from your MPH coursework into a public health scenario. Now, many of our students choose to do this right at their workplaces, which we fully support. We just require that this be something that you are newly creating for the ILE, for the practicum, and this is not something that you've been working on before you start the program. And we have a wonderful applied learning coordinator who can meet with you to help you finesse this idea. And, we can help you develop this idea as well. All the students in our program are assigned a faculty advisor in the second semester of the program. So you have a dedicated faculty member you can go to for advice on how you can structure your practicum, what are things you can possibly do at your sites. They will work with you for ideation, and ideally you'll have someone at the site where you're doing your practicum who'll serve as your preceptor, who can engage with you and tell you what their organization needs from you. But our faculty advisor is there to help you out thinking more practically about the public health aspect of your project. Whereas the ILE is a course that you take, which is GPHP 2900, which is a 4-credit course. All our courses are 4-credit courses or 1 unit, according to Brown. So it is a credit-bearing course that you take at the very end of your program. You can either do a literature review or secondary data analysis, and you write a 10-page paper similar to a thesis paper, and you go through this week by week with support with the faculty instructor. So this is not something that you're having to develop on your own. You don't have to go out there, find a thesis advisor. We will give you an advisor. We will give you this faculty member who will help you with all the way from coming up with a research question to your final draft of your paper.
All right. Thank you so much, Nithya, for the overview of our curriculum and the ILE and practicum. So now we're going to switch gears a little bit. And Kim is going to walk us through the application checklist. So Kim, what can you tell folks on what they need to apply for the program?
Perfect, thank you. So our application is pretty typical, pretty standard. You have to have a bachelor's degree, obviously completed. You also have to have a minimum of 2 years of professional work experience prior to starting the program. And I get asked the question a lot, does it have to be in public health? It does not. It can be in any field, but it does need to be a professional setting. So just keep that in mind. And obviously you'll need to indicate that on your resume or your CV, whatever format you want to use is absolutely fine. We do require 3 letters of recommendation. Ideally, the committee would like to see a combination of academic and professional. I have definitely talked to a lot of people who academic letter of recommendation is a bit challenging because they graduated, say, 10, 15, 20 years ago. So for them to have to go back and get one, it is not really doable. So go with all 3 letters of professional recommendations. You want to pick very wisely. And I'm going to get on my soapbox for just a moment because this is the one area that I have seen people either not be reviewed by committee because they're waiting on one more letter of recommendation, or they end up getting denied, and in large part because those letters of recommendation come back with a statement or 2, just one sentence or 2. That is not going to show the committee who you are, what you're capable of, what great qualities you have, what you would add to this program. So pick wisely. And my other suggestion to letters of recommendation is give them 2 weeks to write it. Why? Because 1, you don't want to have to chase them down week after week to get them to write you a letter of recommendation. It becomes very awkward and off-putting, and it makes you feel bad. But 2, these are really busy people we tend to ask. These are professional people. They got a lot on their plate. And honestly, they would like nothing better than just to check it off their to-do list. So give them a short window of time to get it done. And if they tell you that they can't, move on to the next person on your list. It's no slight against them. They just can't get it done for you. So I'll step off my soapbox here. Transcripts. The committee is actually willing to review your application packet with unofficial copies of your transcripts. But you do need transcripts from anywhere that you've studied. So not just your degree-bearing schools. You will have to provide official transcripts from everywhere if you are admitted into the program prior to starting your classes. So just keep that in mind. I know some people would rather just knock it out. We'll send you the officials. That's great. If you have unofficial copies, typically that's either free or you have them on hand. The other thing I want to mention is the personal statement. The personal statement typically is between 500 and 1,000 words. Really, this is a chance for committee to get to know you a little bit better. Yes, they're going to see your resume. Yes, they're going to see your educational history through your transcripts. But in all honesty, they want to know you. What drives you? What's motivating you to pursue a master's in public health? Why our program? There's a bunch of programs out there. Why us? What is it about our program that pulls you in? So just know that the audience you're writing to are people who are very passionate about public health. And so you want to be able to relate to them in that way as you sit down and write your personal statement. Application fee, it's $100. I know I get asked a lot, can it be waived? Yes, when you get to the end of your application on the final page where you're getting ready to submit and pay for everything, there is a link where you can ask for that application fee to be waived. Sometimes we have sort of special deals throughout the year just to kind of entice you a little bit. I mean, $100 is $100. That's always nice to have in our pocket. And then for international applicants, most of you, there's my little caveat, my little asterisk, most of you will have to provide a proof of language, English language proficiency. We accept the TOEFL and we accept the IELTS scores. And then for, again, for international applicants, you will need to have your transcripts evaluated into American credits. And on the screen, you can see it says a WES transcript evaluation. That tends to be the most popular. They tend to get it done relatively quickly. But we also will accept those from ECE and SpanTran. So just know that, tuck that away in the back of your pocket. And once everything is on file or submitted through your application, I should say, we then consider your application complete. And keep in mind, there are some embedded questions throughout the application process. You will have to answer those. We know that there may be a little redundancy. That's okay. just make sure you get everything addressed. But once that application is complete, I immediately send it to committee to start the review process. So we don't hold it for any specific deadlines. We have rolling admissions. So as soon as it goes to them, they typically will have a turnaround time of 4 to 6 weeks, and then you get your decision back. One of the things I will state, because I'd already gotten a question about the Dean Scholarship. Let's talk about scholarships. So when committee is reviewing your application packet for admissions, they are also using your application packet to determine if you are eligible for a merit-based scholarship. So scholarships, those merit-based scholarships, they take a very holistic approach when they do your review for both admissions and scholarship awarding. Those scholarships can range up to $30,000. But here's the kicker. For anyone who applies for summer 25, and yes, we are appealing to you to come join us for summer start. First of all, it's a much smaller group, and so you would get a lot of attention. But for anyone who applies for summer 25 and you're accepted into the program, at minimum, you will receive the Dean's Scholarship of $12,000. That's huge. That is an automatic, and you don't have to do any additional application. It all is done in the review process by the committee.
All right, thank you, Kim. So I will address one question as we're on this slide, and I see Nithya is typing an answer. And I know we get this question a lot. Do the 2 years of professional work experience have to be dated after the bachelor's degree, or can folks use things like internships as professional experience? So I'll let Nithya, since you were typing an answer, would you like to answer that live for folks?
Sure, and I see Kim nodding too, so maybe I'll turn to Kim after me. So yes, it has to be after your bachelor's, but we do take internships that you've done during the program if they are significantly large. So for example, if you worked 20-30 hours on an internship and it's significant work experience, so it's not something that is like a college project that you did for a short term or something, but like actual work experience that you've had in a professional setting, we can absolutely count that. We add those up to help you get up to the 2 years. So let's say you have worked 1 year after your bachelor's degree, or like a 1 year and some few months, and then you also work throughout your undergrad in an internship setting where you've significantly spent some time, 20-30 hours a week doing that internship. We add that up to help you reach that 2 year mark. And I will turn to Kim to confirm or change anything.
I actually was just going to clarify with you, Nithya, because I know that we've had some applicants who've been admitted who did their bachelor's later in life, but
Oh, yes.
prior to that, they've had like 20 years, 15, 20
Absolutely.
years.
Yeah, we count those.
Okay.
Absolutely. Yeah. we do.
Okay, perfect. So my understanding, and Nithya just confirmed, is your professional work experience can be either prior to your undergrad, during your undergrad, or post-bac. You just want to make sure it's professional. And I can't stress that enough.
All right. And I see we have some questions rolling in, which is awesome. Please continue submitting your questions. There's one question: is there a fall 2025 cohort? There is. So I'll have Kim, if you want to go over the upcoming deadlines, and then we'll answer some of these questions for folks.
Perfect. Yeah, thank you. So summer obviously there's only, one final deadline here for our summer start. It's March 1st, plenty of time. Quite frankly, I've had people start and finish their application within a matter of a day or two. So it doesn't have to drag on, just so you know. So there is plenty of time to still apply for summer. This semester, classes actually start May 19th. So just keep that in mind. And then for fall, that application is currently open. Our early action deadline is March 15th. What's awesome about that deadline is that your application fee is automatically waived. So that's a little perk and benefit. Priority deadline is May 1st, and then final deadline is going to be June 1st. So plenty of time in there. The semester actually starts on September 3rd. Classes will start that date.
Perfect, thank you. So let's dive into some of these questions. So Okay. Someone asked, I have already submitted my application for the fall. Can I ask to be considered for the summer 2025 cohort? So either Kim, Nithya, does anyone want to take that?
So correct me if I'm wrong, Nithya, so they've already submitted for fall. If they go through the review process and they're admitted for fall, they can actually opt to start in summer. Is that correct?
That's correct. Yeah, actually, Emily, you know the answer to this one. I would tell you because you handle this process, but yes, isn't that
Yes.
Emily?
Yes. So if you are applying for fall, and you are accepted for the fall 2025 cohort, you can, pull forward to the summer 2025 cohort. So same for, if works the opposite way. So if you're accepted for fall 25 and you want to defer your admission, you can defer your admission up to 1 year from your acceptance date. But yes, to answer your question, if you're accepted for fall 25, we can pull you forward to start in summer 2025. So great question. Does attending another program at Brown University affect financial aid eligibility?
I can answer that one.
Yeah.
Okay. Do they make the distinction of at the same time in their
No.
question? Okay.
Vanessa, if you could clarify what you mean by that, we can better answer your question.
I'll just go out and say across the board, if you, so basically FAFSA will not support more than one program at a time. So if you're using FAFSA, federal financial aid, for another program with Brown, you would not be able to use that for 2 programs at Brown or anywhere, to be honest with you. They're not going to support you. FAFSA will not apply to more than one program at a time. I'll just stop there.
Okay, clarification. Thank you, Vanessa. I attended the Executive Masters in Healthcare Leadership, but did not finish.
That's fine.
Okay. All right. Thank you all for your questions. So how many students are usually in the classroom, and can you choose your own day or time for each classes? So
I can take
Nithya, I'll
this
turn.
one.
Yeah.
Yeah. So we usually have, I think the most is about 60 in the classroom. And again, we break it out into co-instructors. There's teaching assistants who help out if there's too many students in the classroom. We usually try to keep it low. You cannot choose your own day and time for the classes. We have, for example, all of our content is taught asynchronously on Canvas. So you can absolutely choose what day of the week you want to go in and watch those videos. But then we have a synchronous component, which is a 1-hour lecture with the faculty of that course. That is pre-selected, so you don't get to choose that day and time for the synchronous session. But we also recognize that you may not be able to attend every single synchronous session. So we do record those so you can go back and watch them. And we don't take attendance, so you can go back and watch them at any point.
Are Rhode Island residents eligible for consideration for the online program, or will those within commuting distance be expected to attend in person? Great question. So yes, we do have students from Rhode Island who are attending the online program. So you're not required to attend the in-person program. So that would be, if you're interested in the in-person program, great. That would be a completely separate application process. But if you're in Rhode Island, you can absolutely apply and be part of the online program. We do have a number of students from the state of Rhode Island, so no kind of requirement there. So great question. This one is more about work experience. I have been doing doula work full-time for 2 years. Is this acceptable?
Yeah, absolutely. So just make sure when you're putting in your work experience and in your resume, you say that this is full-time work experience, full-time in our experience is 40 hours or more. So make sure you put that you've done that kind of work experience and talk about how that's, in your personal statement, talk about that work experience and how that relates to you wanting to get your public health degree as well.
Okay. So the next question is, looks like I am overqualified. If I have more work experience, 15 plus in healthcare communication, would I be deemed a good fit? So most of our students have between 5 and 10 years of work experience. So you know, the work experience and the variety of applications that we get from students is very vast. So, you know, definitely apply if you're interested. We do have some folks that are working in healthcare communications as well. And then the second question is, do you need assessed transcripts, as my bachelor's is international, but master's is from the US? The answer to this is yes. We do need an international credit evaluation from any school outside of the United States, especially if it's your bachelor's degree. But yes, we would need that.
I will add that, we've had, even though, yes, our minimum work experience is 2 years, like Emily said, 5 to 10 is the typical range that we see in our cohorts. Many of our students have 20, 30 years of experience. We have professors emerita in our program. We have, all kinds of people with several years of work experience who are looking for a second career at this point to, shift into after doing years of another career. So you will be in good company if, you bring in that much years of experience. And unfortunately, yes, we do need transcripts for any undergrad that has happened outside of the US, because this is something that we've had to do even for those who have a master's, doctoral degree, medical degree. Even if you have those, if your undergrad was outside of the US, we would need transcripts for those, the ECE evaluation or WES evaluation.
And then on the other side, for someone applying with limited public health and statistics background, are there any recommended prerequisites to be completed before applying?
I'll say that for, if your transcripts doesn't show enough quantitative experience or having taken classes, like if you don't have calculus or algebra or some sort of math courses in your undergraduate transcripts, I'd recommend just doing maybe even a Coursera course on basic biostatistics or, college level math courses, anything you can find that shows that you are able to take graduate level math work and you can pass it. That'll really help your application, especially if you feel like your transcripts as they are right now don't have enough math work on there. Even if you have one or two math courses at least in your transcripts, I'd say that is that's helpful. As for statistics, I don't know, Dylan, do you have any suggestions? I think Coursera is what I can think of.
Yeah, I feel like that's a great resource. I don't know if it would be interest, but I know Phoenix of Arizona offers like 1 credit courses that you can take. But yeah, I would say, anything like probability and statistics course, if you haven't taken it, it would be a good choice to get into it to see, because I think there is a biostats course in this program. So
Yeah.
3. Oh, Kim says 3, yeah.
So this question is along the lines of the practicum. So for folks not currently working in a public health related job, how do they usually go about finding an MPH practicum?
So we have a practicum coordinator who can assist you with making connections at the school. So it is up to the student to secure the practicum. But Brown, like I mentioned, has several research centers. We also recommend students to go out to their local communities. So we've had students, for example, in California, who worked in the county department of health, who worked at the state department of health, or any other nonprofit that's near them, or even a health clinic that does more local care delivery. They can work with those clinics as well to find a project. I think there are many institutions around you in your community that you can go and just find, even a dental clinic or an eye clinic, anywhere that you can have a connection to. I remember that one of our students said something, that she bumped into someone at a grocery store and she mentioned to them, oh, I'm doing this master's program. And they were like, they were able to connect her to some other mindfulness center that was able to give them a project on mindfulness to do for the practicum. So you never know where these practicum opportunities are going to find you, and which is why we don't expect you to come into the program. So you don't have to come into our program already having an idea of what you want to do for your practicum. We, in fact, encourage you to just take your first semester to get used to being a student in the program. And from your second semester onwards, you can have meetings with your faculty advisor. You can have a meeting with the practicum coordinator, and they will help guide you and help you think of where you can potentially do your internship. I will say till now, all of our students have been able to do practicum. So of course, there is a difference. Many of them want to get paid opportunities. Now, those are obviously more competitive, but for unpaid practicum opportunities, it's a lot easier to find those.
So our next question is, do you accept a 3-year HND certificate into MPH? By HND is in public and environmental health. So I will turn to Nithya. Is this something that we would accept? Oh, I think you're on mute.
Sorry, I'm not sure. Kim, do you know the answer to that one?
I'll be honest, I don't know what HND stands for. Could you clarify that for us?
I think just a quick search that I did because I wasn't sure myself. A higher national diploma, is that correct? Whoever asked that. It sounds like
Oh.
it's more geared to prepare you for like the working industry. But I could be wrong.
So if it is a national accreditation, that will not count, unfortunately. It has to be you have to have your degree from a regionally accredited university.
Yes, they did clarify, HND means a higher national diploma.
Okay.
Okay. After applying, how long does it usually take to hear a decision? It usually takes about 4 to 6 weeks to communicate a decision. And do you have to have a certain GPA from your bachelor's degree? How competitive is this program? So I will let Nithya and Kim answer this one.
So I wouldn't say a certain GPA from your bachelor's degree. Again, you are assessed in comparison with your pool of applicants. So if you feel like your GPA is not that great just from, your collective experience, then I would say you can supplement it by doing other coursework, like I mentioned, the Coursera course or something else that can boost it and say that you do have the ability to do tough courses or coursework. Also reference things that you do in your current job. For example, if you're already working in public health or you're working in a banking or finance or software role, then you do apply quantitative skills in your current job. So make sure that you highlight that in your application and say, while I may not have the most stellar GPA, here's how I apply tough concepts or these quantitative skills in my work. And that can really help make your application stand out. I will say the program is competitive. We are an Ivy League program. We get applications from all over the world. It is a pretty highly ranked program, so it is competitive. But we do our best to ensure holistic reviews. So we are not just looking at students' GPAs, we are looking at every factor. So we're looking at your background, who you are as an individual, from your experiences, how your previous experiences may have impacted your ability to do college. If, for example, you lost someone when you were in school, make sure, if you feel comfortable, include anything like that that can help justify low grades. During a semester, you can call that out and say you were going through something. We read those things, we read that, and we make sure we account for that. And we also look at your personal statement. Now, your statement, I know it's a statement, but it's really an essay. Unfortunately, just today we were looking at an application that had just a statement, and personal statement has to be an essay that is detailed enough, that gives us a summary of all of your experiences and that tells us who you are and why you want a public health degree and how this fits in with your goals as a person who's coming to Brown. So the more you can say why Brown, why now, and how it fits into your goals, I think that will be really helpful in making your application stand out. So we look at your resume, we look at your academic performance, your previous personal experiences, your statement, and of course, your letters of recommendation. Like Kim said, if you can get people who know you professionally, so they either know you from your work or they know you ideally from an academic setting, but we understand, if you've been out of school for like 15, 20 years, you're not going to be able to ask academic references, but then get professional references who can attest to your skills, because we're not looking for people who can attest to you as just people, but also like, do you have the capacity to do coursework? Do you have the capacity to excel in an educational program? That's what we're looking for your references to talk to us about. So get letters from people who can attest to those skills, and those also will help your application stand out.
Thank you, Nithya. And folks are saying that was a great answer, so good job. All right. So someone is asking about the quantitative preparation. They took biostatistics and college algebra. Is that enough for their quant prep?
Yeah, I'd say I think that should do. Anything that shows some history of math coursework, that's fine.
All right, then we'll go back to the practicum. Can you provide examples of a practicum in a corporate healthcare setting?
So I'll say one of my mentees, she did a needs assessment survey. She worked at their workflow. She looked at how they have people coming in, what is their current process for their workflow, and where there's some missed opportunities to improve the workflow to make it easier for patients. Other things that people have done is really just assessing barriers for patients. Why are patients missing appointments? What can be done? And then doing a more deeper dive into what are some things the clinic or the hospital can do to address those. Maybe they need a social worker, or maybe they just need appointment reminders. So working with patients to figure those things out, those are some examples of work that people have done at a corporate healthcare setting, or even at a clinic setting, they've done that. Again, sometimes these healthcare settings also have their own data. Sometimes people do chart reviews to help identify gaps. They can look at how people are, like the readmission rates, hospital readmission rates, what is influencing that, or how long they're staying, are they getting post-secondary infections? So it depends on your interest, and it depends specifically on which department in the corporate setting you're working in. And then you can also work with your supervisor. They'll have a bunch of ideas too that you could do. And like I said, our faculty are also available to brainstorm ideas with you. If I know more about the specific department within the hospital, we can help. So lead DEI settings, not patient work. Yeah, DEI is good too, so you can talk about maybe it's a staff DEI role that you're in, and you can look at burnout amongst your fellow hospital coworkers or clinical coworkers. I know there's always studies being done about nurses and burnout and hospital infections rates and stuff. So that's definitely something you can look into as well.
All right. So do you all offer fellowships for minority students or HBCU graduates?
So we don't offer fellowships. Our scholarships are applicable there. We only offer merit-based scholarships in our program. There are no separate fellowships offered in the online program.
Okay. So I was admitted with scholarships for summer. Congratulations. Would it be possible to change my start date to fall and still retain the scholarships awarded? So yes, you can absolutely defer to fall. Your scholarship is not guaranteed, but if you reach out to us, we can definitely let you know if you would be able to keep that. So yes, definitely reach out to me. We'll provide contact information at the end, and we'll be able to get you deferred. The deferral process, you will need to submit your enrollment deposit, and then we can defer you to up to 1 year from when you were accepted. So if you're accepted for summer 25, you can defer all the way up to summer 2026. So yes, absolutely. Please reach out and we'll provide contact information at the end. This might be more of a Nithya question. I am an MBBS holder with 24 years post-grad. What are my career prospects in public health, presently working in public safety?
Yeah, I mean, I'm happy to take a guess. It's really hard to say, especially right now, to say public health prospects. But, as you seem to be a clinician with years of experience in public safety, there's always opportunities in state departments of health. There's consulting roles that are always open. We have a dedicated career services director, Emily Nolan, who's wonderful. She meets with our students one-on-one. She helps you look up opportunities. She gives you access. We have a separate LinkedIn group for Brown students. We have Big Interview, and we have other job interview prep resources. We also have a Center for Career Exploration, I believe. Emily, correct me if I'm wrong, but they also help look through your resume and cover letter, and they work with you on fine-tuning all of your job application materials, and also do mock interviews with you so you feel prepared when you're looking for jobs. And Emily, who's dedicated, and she's specifically with the School of Public Health, she can work with you to help you identify jobs in the industry that you are interested in.
All right. So it looks like that's all our questions for right now. So I will move on. We just did the live Q&A. So here is our contact information. So you can reach out to us by email. That's online sph_admissions@brown.edu. I apologize, the email is underlined, but that is online sph_admissions@brown.edu. And you can also make an appointment with your graduate recruitment coordinator. So that is Kim. So that is the link to make an appointment. And I will be sending the recording of this, and it will have the slides in it as well. But if you want to take a picture of this and write down that, so you can set up an appointment with Kim. So Kim can really help you with your application and any questions that you might have on the application front. Thank you. This was very helpful. Oh, I'm so glad you got a lot out of it. So I see we have one more question, the NPH that is non-accredited. Can you tell me about the dual MPA and MPH program? So Nithya, if you want to take this one.
Yeah, so the MPH that's not accelerated, I
Excellent.
don't know if they mean the in-person program, the regular in-person. This is for the online program, that's 2 years. And then the dual MPA, MPH is an in-person program. So I'm not too sure about how that is run and how that's structured, but maybe Emily, we can find that they can reach out to the admissions email and we can forward that over to the MPA MPH dual program. I think Elizabeth
Yes.
Jacquini is the coordinator for that one, if I'm not
Yep.
wrong.
Yeah, so please reach out to the email on the screen and we'll get you in the right direction of the folks for the program that you're interested in. All right, so we are getting close to the top of the hour, so I just wanted to 2 years online is cool. Oh, good. Yes. Okay.
Yeah, that's a good
Yeah.
question about so this. Sorry, Emily, I jumped the gun.
No, you're good.
I read the
We're still on
question and I
time.
was gonna answer. I reside in Baltimore. Is anything I have to come to Rhode Island during the course? No, absolutely. You don't have to come to Rhode Island. This is a fully 100% online program. That doesn't mean you're not welcome to come to Rhode Island. You're welcome to come here. You can come get a physical ID from the card office. That'll give you access to all of the spaces, just like any other in-person student. So you're welcome to come here. But there is no component of the program that's in person. So you can attend it from anywhere in the world.
All right. Thank you. This was very informative. Well, I'm glad you all got a lot out of this. All right, so I just wanted to thank our presenters. Thank you, Dylan, Kim, and Nithya for your insight. And remember, the summer 2025 application deadline is coming up on March 1st. Great opportunity to get the Dean Scholarship if you're accepted. And again, please reach out if you have any additional questions. But with that, we will close the webinar. I just wanted to thank you all so much for attending, and I hope you all have a wonderful rest of your evening.